why do most injuries recur in many of our patients? Well, one, they don't spend enough time in physical therapy. They don't complete their plan of care. Two, a lot of patients focus on their symptoms. They want pain relief and they want it right now. Unfortunately, once you solve your pain issue, which is something that we're very focused on, there are some underlying biomechanical issues, oftentimes faulty movement patterns, mobility deficits, and strength deficits that need continuous work. And nobody, not even a fit 19-year-old Olympic athlete, increases their strength quickly. Strength increases happen over time, 6 to 8 weeks of consistent training that's periodized appropriately for the specific patient. So, the reason that many injuries will recur is that there's just not enough time elapsed and focus on all of the underlying issues contributing to that original injury. Mobility deficits, movement patterns that are faulty, and strength deficits, all of which need specific focus, time, and attention so that the chances of the same injury recurring become less and less and less. Thank you.